I'll go ahead and turn this over to UNM Hospital Chief Quality and Safety Officer, Dr. Rohini McKee.
Thank you, Mark. Good morning, everyone. Thank you for the opportunity to speak with you today. At UNM Hospital, we continue to see very high numbers of patients. We are still well above capacity. I know that there is a lot of concern about new COVID variants, but I think the best thing we can do at this point in time is to double down on the tools that we know work against this variant and all variants of COVID. And so my ask today is that those of us that are still unvaccinated really think about what we are allowing the virus to do in our communities, and highly encourage you to get vaccinated. Highly encourage you to go get your flu shot as well. If you have children between the ages of 5 and 11, a large number of children are getting infected every week in this country. And one of the best things we can do to protect our communities is to get those children vaccinated as well. But most of all, we need to stay calm and understand that we have the tools that we need to deal with Omicron or Delta or any other variant. And we know what those are. They may not be glamorous, but they work. And that is good hygiene measures, wearing masks, avoiding indoor gatherings, especially with the unvaccinated. And those are the sorts of things we should be focused on to keep our community safe during the winter. Thank you. I'll be happy to take your questions.
Thank you, Dr. McKee. And next we'll go to Presbyterian Chief Medical Officer, Dr. Jason Mitchell.
Thank you so much. Within our Presbyterian healthcare system, we continue to see growing numbers of both individuals who delayed care and are sicker, as well as individuals with COVID. Currently in our system, we have 220 people that are hospitalized with COVID, which is about 28% of our hospitalizations. At our last press conference, only about 20% were COVID. So we're continuing to see it grow. And as we look at the modeling and the data, it looks like it's going to continue to grow through December. Remember that the hospitalizations today are from infections, 2 to 3 weeks ago, and the way things are going, we expect higher levels of hospitalizations. The other thing I think it's important to recognize is that 85% of those individuals that are hospitalized are not vaccinated. So we know we have the tools, as Rohini said, and that's vaccine. We also know that over time, immunity wanes from the vaccine, and so a booster is necessary. Currently, only 23% of New Mexicans have received their booster. So if it's been 6 months from your first shot of Pfizer or Moderna, or if it's been 2 months from your J&J shot or longer, it's time for a booster. So make sure you get those boosters. That helps keep you very, very protected and helps keep you out of the hospital. At Presbyterian, we continue to work and make sure we can take care of patients safely with these high volumes. At this point, we've brought in over 500 nurse travelers from around the nation to help take care of our patients. We continue to open up new clinical areas, and we unfortunately continue to have to limit any non-essential procedures, so there's room in the hospital for those that are ill. So we continue to pull out all the stops. I agree, we have all the tools we need to stop this pandemic. We need people to get vaccinated. We need people to get their boosters. If every New Mexican who can get a vaccine, so that's everyone in New Mexico 5 and up, got vaccinated in the next couple of weeks, this pandemic would end in New Mexico within the next probably 6 to 7 weeks. So we have that ability to return all of our lives to normal. Vaccine lives every week.
To enter the pin, rather than suggest our answer in our question, because
just a reminder to everybody, please be on mute with the exception of the speaker. Thanks.
So again, we have everything we need to end this pandemic here in New Mexico, and that's really the vaccine. And so if everyone 5 and over got vaccinated in the next couple of weeks, this pandemic would end for New Mexico within the next 6 to 7 weeks, and we could all move on to our lives and all the wonderful things we want to do. So I just encourage everyone, if you're hesitant, please get vaccinated. If you've been vaccinated, it's time for a booster, get a booster. And I'm very happy to answer questions about any aspects of COVID or healthcare here in New Mexico or across the nation. Thank you.
Thank you, Dr. Mitchell. Next, we'll go ahead and open it up for questions. If you have a question, please let me know in the chat and I will call on you. We'll start with Colton Schoen at KOB.
Hi there. Thank you both again for doing this update. So my question is there a healthcare worker shortage right now in your hospitals? And is that contributing to a number of beds not being used because it just can't be fully staffed?
So I can answer that. For UNM Hospital, we have hired hundreds of traveling nurses during this pandemic, varying numbers depending on the need. And we have worked very hard in order to keep our nurse-patient ratios to an acceptable level. We are still at 140%. Not only are we using every normal bed that is available to us, we are using parts of the hospital that are normally not used for inpatient care to care for patients. And there is not a single bed that is not being used right now because of a shortage of healthcare workers at UNM Hospital.
At Presbyterian, also, we run much higher than our licensed capacity as well, which is why we've brought in over 500 nurses to help staff that. So we use every bed. There are no empty beds at Presbyterian. I think as you think about healthcare shortages across the state, we need nurses. Sometimes people need nurses in their homes for home health. There's many post-acute facilities, skilled nursing facilities, nursing homes that need to make sure they have the stuff they need. So oftentimes, we may have a patient that's ready to go home or go to the next place to heal, but those places may not have the resources they need. And so as a community, we need to make sure that upstream of the hospital and downstream of the hospital, everyone has the workforce they need to take care of people. And so as Rohini mentioned, we've brought in just a very large number of nurses to make sure that we can safely take care of patients, but we still have backups, across the state in getting patients out of the hospitals. And also the number of patients that show up at our hospital just ultimately exceeds our capacity.
Great, thank you guys both for answering that question.
Thank you, Colton. Next, we'll go to Austin Fisher at Source, New Mexico. After Austin will be Julia Goldberg of the Santa Fe Reporter. Go ahead, Austin.
Hi, guys. Thanks so much for making yourselves available to us. I really appreciate it. I wanted to follow up on Jason's comment that if everyone got vaccinated, the pandemic would end in New Mexico. My question is about the inequity in access to vaccines, which has, at least in part, led to the rise of new COVID variants. I mean, it's, of course, Omicron currently. Could you comment, both of you, on how the lack of vaccine access in many parts of the world, especially the global South, affects New Mexicans?
Yeah, I'll start locally first. So in New Mexico, we've worked really hard on vaccine equity. We meet both as a state and in our own systems to ensure we deliver equity. And as you look at the vaccination rates and look at vulnerability indexes across the state, you can see a very equitable distribution. So we've worked super hard to distribute equitably in New Mexico. We're able to do that because we think about it, we work hard on it, and we have the vaccine, right? And it's a privilege here in the United States to have the vaccine. I think the challenge is looking at some areas in the world where they may not even have refrigeration in 60% of the homes and may not have the ability to get the vaccine out. And so the more COVID that is out there infecting people, the more variants you get. And so with more infection, you get more variants. And so that is a risk, which is why you hear a lot of the kind of global international talk about all of our roles in vaccinating the world. So I think there's two things, and obviously what we can do here in New Mexico is prevent variants from happening by having everyone get vaccinated because it is available here. And then at a national level, I think different countries are figuring out how they can help one another vaccinate, because ultimately that's how this stops, is when as a global community we get enough vaccine out there that we can stop infections.
So what I will add to that, Austin, is that scientists have been saying for a long time, and we have said on this forum a number of times, that the more people you leave unvaccinated, the higher the chance that you are going to see a dangerous mutation. And with regard to South Africa, about 29% of its population is vaccinated currently, which means the virus had plenty of opportunity to replicate. And we also know that the virus replicates at a low level for a longer time in an immunocompromised host, or a host whose immune system is not as strong, and therefore has further opportunity to mutate. And I think that really speaks to the importance, both here in New Mexico and worldwide, of getting as many shots in arms as possible, because we are so connected globally. We already know that this variant is in 15 different countries and 5 continents. It really speaks to the importance of thinking both locally and globally about getting as many shots in arms as possible.
Just as a follow-up, I mean, would either of you be able to comment on the TRIPS waiver at the World Trade Organization, the proposal by South Africa and India to waive patent protections for vaccines in order to allow them to be manufactured in these countries that still are widely unvaccinated?
I think probably both of us are, our focus is here in New Mexico and what we can do here. Right now it's not at setting the international policy, and so it's hard. I don't have a specific recommendation or comment on that.
I think what I would say as a physician and the physician community in general is supportive of policies that provide equitable care. And the physician community is supportive of policies that will work to end this pandemic globally. So insofar as we can comment on that, I think it's safe to say that we would stand behind those sorts of policies. But more than that, I don't believe that's in our swim lane.
Thank you, Rohini. That was a very good answer. I appreciate it.
Thank you.
Thanks, Austin. Next, we'll go to Julia Goldberg of the Santa Fe Reporter. After Julia will be Stephanie Muniz at KOAT. Go ahead, Julia.
Thank you, Mark. Thanks, Dr. Mitchell and Dr. McKee. So last week, Tim Johnson from Presbyterian told lawmakers that there'd been an uptick in violence at Presbyterian facilities against nurses, and increased security measures had been put into place. I followed up here in Santa Fe at Christus and heard they were experiencing a similar dynamic, although attributing it to different causes. But I wondered, well, Dr. McKee, I wondered if that was also happening at UNM, and I wondered if each of you could maybe share a little bit about how you're addressing that with staff, sort of what that impact has been like. Thank you.
So Julia, I am not aware of any increased incidents of violence at UNM Hospital. I think it's fair to say that the healthcare community, as well as a lot of folks out in the community, are stressed by numerous factors, related and unrelated to the pandemic. But thankfully, at this time, I don't believe we have seen any uptick in violent incidents within UNM Hospital.
Thank you. Yeah, we have seen an increase, as Tim Johnson mentioned. We have seen an increase in violence against our healthcare workers, and so there's a lot of things we can do. One of them is recognizing that that people are really stressed, and not just our healthcare workers, but our community. And oftentimes when they're coming in for care, they may be at their personal worst. And so, one is having sympathy for the people that are coming in and need help. I think the second thing is recognizing just what a hard place it is for healthcare providers to be in right now. We have put in metal detectors. We have increased our security. We have ways now to alert if there's help that needs to be done emergently, if someone needs help emergently. And we've also done a lot of training for people to recognize and defuse those risks. The other thing we do is help support people. When bad things happen, whether there's violence that occurs, or whether you lose a patient, we have to deal with death and loss, and it's hard for healthcare providers. We really do our best to support providers. We have what's called a Code Lavender team, where there is a trauma, and whether that's emotional trauma because you lost a patient, or emotional trauma because there was a violent person in your facility, we bring together and we talk about it and support each other. And I think it's that sense of community that helps people get through it. But yes, it is a challenge for us.
Thank you.
Thanks, Julia. Next, we'll go to Stephanie Muniz of KOAT. After Stephanie will be Algernon Damasa of the Las Cruces Sun News. Go ahead, Stephanie.
Hi, thank you guys so much for making time for our questions today. One of the things that I wanted to know more about is with new variants, will there be more testing or caution aside from vaccinations? And if the variants do reach our state, is there any concern that that will worsen hospitalizations and therefore affect the healthcare worker shortage that we already have?
Stephanie, it's difficult to answer that question now. I think we will have a lot more answers in about 2 weeks. One of the most important things we're waiting on is information on how effective existing vaccines will be against the Omicron variant. This particular variant has mutations in 3 important areas on the virus that allow our antibodies to recognize it and to neutralize it. And we've never seen this before. With the beta variant, for example, that variant had 2 mutations out of these 3 important areas. This one has mutations on all 3. Those are some of the factors that are causing scientists around the world this level of concern. But because South Africa has good surveillance systems and made this known so quickly, we really do not know whether this causes worse disease. It seems to be transmissible, but again, is that because 29% of South African people were vaccinated? Is that because of super spreader events? We really don't have that information right now. And because we know from dealing with this virus for a while now that hospitalizations and death lag 3 to 4 weeks after an infection, we don't know how sick this particular variant is going to make people. So once we have the answers to some of those questions, and again, we always seem to have countries a few weeks ahead of us that we can look to for these answers, we'll be in a better place to answer that. What I will say is this variant is no different from alpha, beta, or gamma in that if you wear your mask, if you get vaccinated, and there's some preliminary data to say that the booster shot and the increased levels of antibodies may be protective against this variant, those are still effective against this variant, and we should continue to double down on those measures.
I think what's really, really important to recognize is in New Mexico and in the United States, what's causing illness, what's causing suffering, what's causing hospitalizations, and what's causing death is the Delta variant. That's what's happening today and will be tomorrow and for many weeks to come. And we know exactly what to do to prevent the Delta variant, and that's to get the vaccine. The vaccine is highly effective against Delta. So although we always think about the next variant and how we're going to address it and how we're going to work with it, we have to stop and say, but today what's going on? And today, Delta is burning through America, and we can stop it with vaccine. And so that's our goal right now as a community, is to vaccinate and to use safe practices and to test and stop the Delta variant. And then as an international community, our role is to understand what do the new variants have, and do we need to have new ways to stop and deal with them. And so those are the 2 different things. But what we need right now from the community is to focus on stopping Delta and using the tools we have, which is vaccine.
Thank you, Dr. Mitchell. Thank you, Dr. McKee.
Thank you, Stephanie. Next, we'll go to Algernon Damasa of the Las Cruces Sun News.
Thank you, doctors, for the opportunity. One thing I'd like to try to understand is that I know that the part of the patient load right now is a combination of COVID patients as well as a higher than usual load of patients with a variety of other problems requiring hospital care. I'm wondering how dynamic that is, or if that side of what's currently going on at the hospitals is abating. Is it changing? What is the nature of that challenge?
think for us, the challenge is we're continuing to see the COVID hospitalizations climb. So at our last press conference, we had 20% of our beds that were people with COVID that we were treating, and now it's 28%. So we're seeing that grow. Influenza is beginning to spread, and we're going to see more influenza. And then the general degree of illness for other things has not abated. We are seeing patients more significantly ill from a variety of other diseases and illnesses and chronic illnesses. So really, I think the dynamics are we've got we operate at about 120% capacity, and we've got probably 100% full hospital of very sick people independent of COVID, and then those on top of it. So at this point, we're still dealing with the same situation of very sick people from other things, as well as growing COVID numbers.
So at UNM Hospital, we are not seeing any relief with the number of patients who do not have COVID, but are still very sick from a number of other illnesses. We are focused on delivering care to 5 categories of patients that don't have a whole lot of options in New Mexico. There are some unique services that we deliver. And so our trauma census is high. We take care of a lot of strokes, heart attacks. There's some sort of specialized care for pediatrics that only we can deliver, as well as high-risk pregnancies. And so we have not, unfortunately, seen any decline in those numbers, and those patients are coming in pretty sick. Like Presbyterian, we are delaying surgeries that can be safely delayed, but we are still functioning at around 140% capacity.